can protect ourselves
with COVID-19. Gambia is also in the same fight. But unfortunately for Gambia, we have limited resources, hence the need for us to have preventive measures against getting infected. It starts with us frequently washing our hands with soap or using hand sanitizers. Also, we need to limit our interaction with people so that we can stay safe and uninfected. Lastly, if we have people showing signs of coronavirus symptoms, do not take them to a healthcare facility. Let them stay home, call 1025 and allow professionals to handle the matter thereafter. Let us all stay safe. Let us prevent ourselves from getting infected, and let us fight this fight together so that Gambia can emerge victorious.
Viewers, and wherever you may be, welcome to another edition of your COVID-19 Sensitization Forum with me, Mama J. And in this 45 minutes synchronized broadcast program is funded by the Food and Agriculture Organization of the United Nations, the Ministry of Health, and the European Union and other partner agencies. The program, viewers, you're reminded that the program is being hosted by the Gambia Radio and Television Services, your national television station, in collaboration with its sister television stations in the country, including QTV, Star TV, Paradise TV, Muslim Television Ahmadiyya, MTA, and ITV Africa. Once again, I am your host, Mama J, and tonight I have with me in the studio Mr. Malang Fofana. He is the program manager at the National Nutrition Agency. Mr. Fofana, welcome to this program.
Thank you very much.
And the only lady, another lady here I have with me is Miss Lalia Jawara. Is the Principal Scientific Officer, Food Safety and Quality Control Unit. Madam? Welcome to this program.
Thank you.
Very well. And tonight we are going to discuss the topic mitigating the impact of COVID-19 on nutrition and food safety. And like I said, I have my beautiful guests here who are going to lead me through that discussion. And to start with the program, I will turn to the program manager of the National Nutrition Agency, Mr. Malang Fofana. Mr. Fofana, let's talk about this topic, which is the impact of COVID-19 on nutrition. Many a time, nutrition is being sidelined in this whole fight. But it is an important issue because it's also part of health. Why is it important for the nutrition to be part of the fight against COVID-19? Why is it important for people to consider the group, the vulnerable group that are affected by nutrition in this fight?
Thank you very much, Muhammad. Good evening, viewers. I think this is a very important program focusing on the impact of COVID on nutrition. Just like you asked, nutrition is a very important topic in the welfare, life and well-being of every individual, particularly those that are most vulnerable, including the sick and the infirm. In the era of the COVID-19, there are measures that have been taken by governments and the global village, including lockdowns and restriction of people's movement, which has affected people's access to food security. And when we talk about food security, it means having access to adequate and quality nutritious food by all members of the household. If you ask people not to go out, particularly those whose livelihood depend on going out daily to fend for or fetch for food, it will have an impact on their life and livelihood, which in turn would affect their nutrition status. We know nutrition and health are very much closely related. There is a strong relationship between infection and malnutrition. And to put it into a layman's language, if you are sick, for example, you usually have what we call anorexia. Anorexia means you don't tend to have to eat. You don't feel eating.
You don't have appetite.
You don't have appetite to eat. And during time of infection, the need for nutrients increases. And at the same time, you don't have appetite to eat. So it compounded your lack of not taking adequate food at the time. That will lead to you becoming weak or thin, and that's when what we call resting crippled in. On the other hand, if you are malnourished, your immune system becomes too weak and become too prone to any kind of infection, including COVID-19. So the two are closely related. Therefore, if you are fighting COVID-19, we cannot leave nutrition behind because it is very critical in the life of every well-being. And during the lockdown, it's difficult for people to have access to adequate food. Therefore, if we are to make a headway in the fight against COVID-19, we have to ensure that food security is assured, but not only food security, but also nutrition security is assured. If you talk about nutrition security, we're talking about having access to adequate food, which is nutritious, at the same time coupled with caring practices, particularly the hygiene aspect and feeding aspect. Because if you look at food security, it has 4 main elements. One of the elements is the availability of food. Is food available to the people? The second element is, if it is available, can people access the food in terms of purchasing power? Are they able to utilize it adequately in large quantity and adequate quantity to meet their needs? And is the supply, is it stable? Is there any breakdown or shortage of the supply system? So these are very critical elements of food security, which is affected by the lockdown measures that have been taken by government. And this also affects our nutritional status as a country and as individuals.
Now age and certain pre-existing conditions are key factors of this respiratory disease, that is COVID-19, and the elderly are at high risk, of contaminating this virus. Now, because people most of the time, like I said earlier, tend to sideline the nutritional aspect of the disease and focus more on other measures, for example, social distancing and other measures, which I said nutrition is very important. But now, what is there to protect the nutritionally vulnerable group?
When you talk about nutritionally vulnerable group, there are some especially groups that are very, very vulnerable to nutrition. One of those is the pregnant women. Pregnant women are very vulnerable to nutrition because of the need of nutrients during that period, during the last stage of the period. Because when you are pregnant, you require more food for you and also the growing fetus. Children under 5 are also very vulnerable because they are growing, because of the growth, and also their exposure to the environment, and the fact that their immune system is developing, it's not fully developed, so they are also vulnerable. The elderly are also vulnerable, and we have realized that the COVID is very much, those elderly people are very much prone to COVID. This is because as you aged, your immune system also become, human body is like a machine. The more you are old age, the more you become, your system becoming weaker. And when the system is weaker, you are prone to get infections, and that's why they are very vulnerable to COVID-19. And sometimes when you are also old age, your appetite, your appetite is reduced, and you don't eat eat too much. So therefore, the vulnerable need to be focused on in our fight against COVID-19, particularly the elderly, the women, and the children. We need to focus our attention so that their nutritional status is particularly taken care of. Because food is critical, and when there is shortage, we have to make sure that those that are very much vulnerable are not left behind in the fight against COVID-19.
Thank you very much, Mr. Fofana. We'll come back to you. And now we will turn to Ms. Gawara, who is from the Food Safety and Quality Control Unit. It is important to know that, Ms. Gawara, that there is no particular food that can cure or that can prevent people from having COVID-19. Now, food safety and quality control, what is its stake in the whole issue, in the fight or in combating the COVID-19?
Thank you, Mama. I'm happy to be here. Food safety and quality, it's we're the competent authority responsible for keeping food safe and ensure that it's of good quality. And it's across the board. It's food and animal feed, water, beverages, foods that, coming in, imported, and exports. Okay? Now, with food, with the angle of food safety, we're trying to ensure that the population keep in mind that they have to keep what they're eating safe and clean. So we're coming from a hygienic perspective. Okay? Now, these are unprecedented times. COVID-19, it's an epidemic, and it's changed a lot of lifestyle. We've changed our lifestyles.
Exactly.
We're adopting, hygienic practices. We have to wash our hands, and food safety is very big on this. So what we've done is we've come up with guidelines, working very closely with our partners. That's FAO, WHO, Plant Protection, DLS, Department of Livestock, and we've all come together to come up with an YEP. Yeah, that's the Youth Empowerment Project, and they've all come together to come up with posters and hygienic information. As you know, most restaurants have closed down because of the issue. Now, what we advise is you simply make sure everything is clean, because the food you're ingesting has to be clean. And we stick to guidelines like the 5 keys from WHO.
That's what I want to ask. What are some of the 5 guidelines?
Exactly. And basically what we've advised with the COVID is make sure your hands are clean. Keep the hand washing aspect of it has to be a strict rule. Ensure that you abide to the social distancing. Restaurants have closed down, and we're encouraging the takeaway factor of it, where you don't need to have people sitting in your restaurant, and people can come in, pick up the food, and leave. Ensure that you use alcohol-based hand sanitizers, about 60%. Clean your surfaces as often as possible. That is very important. Okay. And we also push that people should ensure that wherever they're preparing food, it has to be clean and of hygienic standards. Okay? So you've got 5 keys, and that's wash the food, make sure it's refrigerated, separate raw foods from cooked foods, store them well at good temperatures in fridges and things like that. FAO is encouraging that people, as Malang said, nutrition is also good. You need access to nutritious food that is good and of good quality and safe. And these should be prepared in a clean place with clean water. We insist on that.
Now, how do you ensure that people apply some of these measures now that the COVID-19 rules and regulations have been relaxed, especially in some of the restaurants that we see open, from time to time? How do you monitor, some of these measures?
Well, we have an inspection team, the Food Control Directorate. They're in charge of the inspectors. So these inspectors go out every day, and they inspect food premises, supermarkets, restaurants, tanganas, wherever you have food being prepared, they're there to guide and tell you what to do and how to deal in this time of COVID. But what we've seen with the restaurants, they're actually doing well. They're abiding to the rules and the regulations, and they're taking on board the guidelines that we've put out there. Restaurants are all closed, and they're encouraging the takeaway culture now, just to encourage the social distancing aspect of it.
But now they're saying that it's no more social distancing, but physical distancing. I think that's what the health officials, health experts are advocating for people to observe physical distancing, at least 1 or 2 meters between,
That's very important.
It is important. Yes. Now, Mr. Fofana, nutrition progress has no doubt been threatened by this COVID-19 outbreak. As a result of this, what will NANA, or do we see NANA use this opportunity, for example, to further strengthen its nutritional policies and programs, particularly for pregnant mothers and children under 5 who are, vulnerable groups in nutritional status?
Thank you, Mama. Before I come to, let me just throw a bit of light on the question you asked, Lalia, about the particular foods that are needed for preventing COVID. If you look at nutrition, to be healthy, you need to have a diversified diet. There's no particular food that is needed for preventing any specific type of infection or disease. Food that you need to prevent you from infection or diseases are supposed to come from a diversified diet. Because if you look at the reason why people eat food, there are basically 3 main reasons why people eat food. One is to have energy to do all kind of activity that you do. 2 is to help you to grow and develop, and 3 is to prevent you from disease and infections. And those food has to come from basically 4 main food groups. These are the carbohydrates, which include cereals and tubers and sweets. And also, food has to come from the protein foods. These are the meat, the fish, the poultry, and its products. And also fruits and vegetables, and fats and oil. These 4 food groups, if you are eating food, you have to ensure that your food composes of these various food groups. The more diversified the food is, the more it helps you to prevent disease and infections, because it builds your immunity.
But there is no
particularly fruits and vegetables. But there's no specific food that you can focus or take on to prevent you from disease like COVID.
Now, I'm sure that you must have, this COVID-19 must have caused a decline in demand for micronutrient diets, such as, for example, vegetables that you're talking about, fruits and other animal source of food, etc. Is there any surveillance that the National Nutrition Agency or mechanism is doing to prevent, or protect some of these vulnerable groups?
Yes, as a national agency, before the COVID, we have some programs that are running, and they are ongoing, and we still maintaining or strengthening those programs. For example, we have the micronutrient control program, where children under 5 are given vitamin A supplementation at the clinic. Pregnant women are also provided with iron folate tablets to prevent them from anemia, which is one of the critical diseases in the country. We also have the IMAM program, which is the Integrated Management of Acute Malnutrition program, where those that are found to be malnourished are taken care of. If they are moderately malnourished, they are provided with Consa blend provided by WFP. If they are severely malnourished, they are at the health facilities where they are given plum peanut, RUTF, including plum peanut, F100, F75, and Rosamol, are provided. That programs are being strengthened to prevent people from becoming malnourished. If they are malnourished, we try to recuperate from the malnutrition. But at the same time, we are also working on some social protection programs, like the breast. We are providing some women with cash transfers to enable them to provide the basic foods that they need in their families. And we are also working with the World Bank on a social protection program where we will provide them some cash transfer to families for them to be able, in addition to governments of cash in-kind food for distribution, they can also use that money to provide some basic food that they need, including the fruit and vegetables that are required for improving their malnutrition status.
Mr. Fufuna, we will take a first break. We'll be back shortly after that.
Basa loxo muy tandi
yéen ñi ñooy toppa si GRTS ñoo ngi leen di nuyu di am mbégte ngir dalal leen si seen beneen programme yi COVID-19 Sensitization Forum bi nga xam ne 45 minutes programme la ñi nga xam ne ñoom ñoo leen ko isil di GRTS ak naataangoom yi QTV Paradise TV, Star TV, MTA TV, mooy Muslim Television Ahmadiyya ak Star TV ak Eye Africa TV ñi nga xam ne naka ñoo dépense programme bi ni mooy tey Food and Agriculture Organization of the United Nations FAO ak European Union ak yeneen i naataango yi nga xam ne ñoom ñoo dépense programme bi ni ñu ànd si naka ak seen national television bi GRTS moom it mu ànd si ak naataangoom yii ne tey nag ñoo ngi leen di isilaati beneen waxtaan boppi waxtaan bi tey mooy impact of COVID-19 on nutrition and food maanaam COVID-19 bi maanaam feebari mbas bii nii loraange yi nga xam ne moom la am ci lekka yi ñam yi nga xam ne ñoom ñooy dundal wala bokk soxi yaram bi ak itamit li nga xam ne mooy lekka yi nga xam ne moom la ñuy def tey ñi ma am si studio bi mooy Madam Fofana moom mooy programme manager National Nutrition Agency NANA ak kii di Lalia Jawara principal scientific officer Food Safety and Quality Authority ñoom laa fi am tey seex ak ñoom waxtaan bii nii léegi nag dinañ dem ci Lalia dinañu wax tuuti moom nag olof am setul wax nañu ko ca njëlbeen kon nag seetaankat yi ba tey rek ñu ngi leen di fàttali ne lii live phone-in programme la mu ngeen ñoo call si 200 2233 200 2233 su ko defee ngeen mën a bokk ci programme bi xelal ñu waaye tamit boo leen amee lépp loo xam ne laajte la rek man fi am experts yi nii ñoom dinañ ma dimbale bu baax a baax ndax ñoom seen xam-xam màcc na ci li nga xam ne moom la ñuy def kon Lalia ñu bàyyi ko waxtaan bi Lalia nu jël la askan gi su ko defee rek ñu xusi programme bi
salaamaaleykum maa ngi leen di nuyu si seen tur ak seen sant man maay Lalia Jawara jërë leen jëf tey dañ ñëw nag pour waxtaan mbiri COVID-19 ak nutrition ak wàllum set si lekka bi food safety ak quality maa ngi jógee Food Safety and Quality Authority suma collègue Malang mu ngi jógee NANA National Nutritional Agency so dañ ñëw tey pour waxtaan mbiri mitigation diggante COVID ak food safety and quality ak nutrition.
Now, pour ñu mitigate the impact on food safety lan la askan gi war a def pour ñu mun a mucc ci mbas bii nii suñ lekka yi ak li nga xam ne moom mooy dem ci biir bi ñu waaye tamit ñu bàyyi xel tamit ne COVID-19 tam moo ngi am.
yeah so léegi luñ def ak suñ partners yi si authority bi ñu ngi laajte ne public bi pour ñu bàyyi seen xel bu baax ñu make sure ne li ñoo lekk dafa set ak seele ñu tooga ko bu baax make sure ne dafa ñor daal ok now mbir bi virus la virus bi foog mu nekk si life cell luy dunda so dangaa gis du lifin dafa mel ni du nekk si lekka ok but dañ war a make sure ne dafa set parce que mbir bi soo tilimee xëy na mun nga koo am waaye so ñu ngi laajte nit ñi ñuy raxas seen loxo yi fooy defaree lekka na set looy use pour defar lekka na ndox bi na set waaye ba pare ngeen tooga ko bu baax mu ñor ñu ngi laajte tamit pour nit ñi ni ñoo patiyee pour toog di waxtaan ak yooyu noonu ñu wàññi ko bu baax li ñoo wax waa jotaay mbooloo ñu wàññi ko bu baax ñoo wax social distancing xaw ma physical distancing léegi waaw so ñu ngi laajte loolu ñu ngi laajte ñu sol masque face mask su fekkee ne mënuñoo avoid physical distancing ñu ngi laajte tamit ñu use hand sanitizers dañ wax restaurant si tëj nañ loolu baax na torop am na solo lool ñu ngi leen a wax ñuy setal seen place yi fu nit ñi di ñëw di laal ñu fompa ko ñu nekk di ko fompa toogu yi ñu ko fompa na nit ñi ñëw ñu just pick up seen lekk yi ñu dem so ñu ngi laajte tàngana yi restaurant yi ak retail supermarket yi yëpp ñu just practice safety measures yi hygienic measures yi adopt 5 keys of hygienic practices yi food production place yi ñu adopt HACCP ba tamit set bi more important
ok set moo gën a am solo ci xeex feebaru mbas bii ne dégg ngeen ko Lalia moo ko wax mbaɗigol milikan juuɓengal konton jiates janto natale jankoten ka alla covid-19 sensitization forum ola mi yalon kon ka natale jang jiates ana ka fiñol mi yalon ko television station dole mil be banko kan janto wolen QTV Star TV Paradise TV Muslim TV television Ahmadiyya aning Eye Africa TV wer mi leñin ko fa dépense wolen FAOT aning European Union aning man sakundala jata kende ya bundala wala Ministry of Health wala fa be ñun ko kunna ya dépense ya ki fo albesira la sol kono albe dawdande albe ñin television station ngamil to fo janto al salon ko ñin mol wala ñi organisation wala ñun ko dépense ba fle ini barabake ngamana fo fana soto janto mi yalon ka botan National Nutrition Agency atelem program manager to jeto bimbe min ka chaka wolem mitigating the impact of COVID-19 on nutrition and on food safety. Wale mbaje la nyadile komi ka COVID-19 ka sembo ni kuran ke so ka sembo ka abetala la nyami surtout na domorol ani nka mi na domoro fengol dal de se kele nyaadile fo ninga dada fana ngambe tanka ni kuran ke sola ani fana mu domoro fengol le fana be domola ni wato kono parce que ngajele ko groupe dol budgeto comme ke bal ni dindingol altel alla ma fa wala mo nutrition ti wolle fan mo vulnerable group ti mi yalon ko ineta nutrition on sanye altel la lodo la mo monete kaje ko ñing impact ni abe mitigate la nyadila kabe tala la nyadila ni groupe to sa surtout ni jankaro la kelo wato la
abaraka baka mama ni covid-19 kurang kedapment dunia ye ngai boliti anin kolea bare brin kurang nyem boita dunia mo sekundali ye yamaro di pour mo sabat sol kono e kana funti bake ka ni mo ka fundi ka fnyoma wala ka kurang nyen danjandi bake adu ngalon ko mo jama fana bije men nyalon ko ila balu session la kan ni ko session kan ha fo funti yita nyini kana ka samana so kono so ni ko wala mamam da balu bolo kan ni ko ci so kono amunda ko abe ko samanan sakura ko ala domoro la karo andu ngalon ko domoro ko ma da harabani wala balo kono bari mo nyina ka domoro bani domoro ka ku sababu domoro ka o tinan ka o mo na fa wala folo fo ni domoro ka ke ma koy e ka sembo so rek bambang ci do kol keno ci de kol be keno ni ka domoro fana si ma ko fana e se men ka yirwa sakura ko dinni wolo an musu kono mal ba ni ka domoro fana ke ma ko ka tankan do kurangon so domoro ka nyina fa les ko balo kono mun do wonna si valla ko wona fa ke balo kono wala no tin sama fe wonni sul ma fe ngolti ani yele ma fe wonni farama fe ngolu ani yirdi fe wonni garne fe ngolu
okay mala aboko ko me kuntu fambare na do ko tanke aboko ko mo dole be la noto kola hello good evening hello assalamu alaikum
wa alaikum salam
welcome to the program kola
wa mama je
wow
wa alaikum salam
waaw waaju baax ñu lay déglu
waaw programme bi rafet na waaye
waaw ñu ngi lay déglu de
mene programme bi rafet na
waaw
waaye léegi déglu naa waxtaan bi te man ko seetaan waaye nag suma jigéen ak suma oncle
waaw
ñu ngi wax lu vital waaye nag buñ ko xoolee
waaw
marché bi moo gën a konjog dafa tight
kay
dañoo joxante xaalis
ñu ngi lay déglu de
waaw ñu ngi lay taxalante te nit dina tusóori nit dina tufli te komawut ba kenam oo yu sutti su peppa ok léegi maa lay ñëw ak sukkur yi
waaw ñu ngi lay déglu waaw ñu ngi lay déglu de
maa lay ñëw ak sukkur yi loolu important na si néewi doole yi ñu ko soxla
ok ba dafa mel ni comme yow nguur gi ndimbal bi muy joxe ci wàllum dunda bi maanaam
waaye li ma wax mooy
waaw
xam nga tëjoon nañ jumaa yi tëj jàkka yi tëj a lot of things waaye nag man si suma xelaat waaye nañ ibi jumaa yi
ubbi nañ ko di
ibi jàkka yi ibi cooj yi
ubbi nañ leen de
waaw accept naa because man koo gis waaw waaye léegi lu tax féeri bi moo gën a taay tëjuñ féeri bi
tëjuñ féeri bi
waaw dama laajte na tëj nañ féeri bi
ok xam naa ñi nga xam ne ñoo amee wàllum féeri bi tamit dinañ leen fi ici su ko defee ñu
waaw léegi nag raxasu bi
waaw
yaa ngi tëddaa sa doom ak sa jabar
waaw koola boobu dem na koola boobu noonu mu ne marché yi problème lañ loolu moom loolu accept nañ ko ne marché yi moom problème lañ te foog naa ne ñi nga xam ne ñooy autorités yi ñoo ngay def seen kéemtalaay kattan ngir gis ne problème boobu tamit solve nañ ko maanaam saafaral nañ ko waaye ñi nga xam ne ñoo amee féeri yi tamit dinañ leen fi ñu seet xam naa ne ñoom tamit ngay def seen lu ñu mun pour gis ne féeri bi képp ku fa dugga nga sanitize sa loxo bi ba pare ñu observe social distancing loolu moom mu ngi am xam naa ne rek ñu ne fas lu mu daw rek nga yokk ko yar moo boobu am na solo ba tey rek ñu leen di fàttali nekk ne mun ngeen a call si 200 2233 200 2233 am na keneen ku nekk si line bi hello caller hello good evening
hello good evening
yeah welcome to the program
hello
good evening sir yes caller.
It is GRTS, huh?
Yes, it's GRTS, QTV, Paradise TV, MTA TV, Star TV, and iAfrica TV.
But I'm down. I'm just trying to call to contribute to the program going on.
You're very welcome, sir.
Welcome.
Is that the case? No.
Yes.
I'm watching the TV, but different person is linked.
Yeah, it's a synchronized program. You just go ahead with whatever you want to contribute to the program. We're listening.
Okay. I want to contribute concerning about this corona pandemic going on.
Welcome, sir.
Okay.
You can go ahead.
Okay, that's it. Okay, my point of view is that at least all the cases that we have are imported cases. So at least the government should at least look into it and then let the internal part of the country be free and at least control the border.
Okay. That's your contribution.
And then moreover also the driver also need to be put into consideration.
Okay. I'm sure the authorities are watching and listening to what you are saying, and I'm sure they will take action on the issue that you're raising now. You want to go ahead?
I'm diseased from, this is a different program from the one going on GRTS.
Okay.
I mean, it's different. You receive me, but I'm calling GRTS program.
Yeah, it's GRTS. GRTS is the main host, and the other TV stations are linking through GRTS. It's a synchronized program, courtesy of the Food and Agriculture Organization, FAO, and the European Union in collaboration with the Ministry of Health and GRTS and its partner television stations. So it's an organized program, if you will. Are you there, caller? Okay, we've Hello, we're listening. You're still not finished, right?
Hello?
Yes, yeah. Caller, we are listening.
Hello?
Hello, caller.
Hello?
Hello. Can you hear? Hello? Hello, caller. Okay, if that caller is...
I think what the caller is saying, I think authorities are listening, but to ensure the borders are closed, officially the borders are closed, but everybody has to be vigilant in trying to ensure that we observe people coming in the country. If you see anybody coming in the country, you can call 1025 to report so that the authority will follow that person up for us to be able to contain the disease.
The disease, okay. And I'm sure the border immigration officers are also very vigilant and they're doing their work. I'm sure we will get them also on board to talk about this porous border because as the caller said, most of the cases are imported cases and it's becoming a concern. So there is another caller on the line. Hello, good evening, caller. Assalamu alaikum. Hello, assalamu alaikum, caller. Hello. Assalamu alaikum.
Waalaikum salam.
Jam rek kay.
Kontaan nañ ci programme bi.
Jërëjëf, caller.
Waaw, man nag li ma jaaxal mooy. Yéen a ngi wàññi taxi driver yi nit ñi. Yéen a ngi wàññi taxi driver yi. Jamale nit ñi. waaye su askan yi li ñooy def dafa ëpp. Li ñooy def dafa ëpp.
Ok.
Lan mooy différence bi diggante taxi driver bi ak private car bi.
Waaw boobu kañ loolu value point la de suñu wàññee commercial vehicles yi obviously private vehicles yi tamit dañ leen war a wàññi loolu foog naa Ministry of Trade ñoom tamit ñëwoon nañ fi amoon nañ fii ni driver président bu National Transport Union muy Omar Cissé gaayam yi ñëwoon nañ fii ni waxtaane nañ ak ñoom ci mbirum driver yi pour ñu wàññi nit ñi soo waxee nag driver xam naa ñëpp lañ wax amuñ xaaj ak seen kon xam naa ne ñi nga xam ne ñoo amee tamit wàll boobu noonu ñoom tam bu ñuy seetaan rek loolu challenge la pour yéen nit ñi ñu ngi observe ne ñu ne according to this scholar private commercial vehicles yi ñu ngi observe the physical distancing ñu ngi wàññi ñi nga xam ne loolu lañ leen wax pour ñu jël si aapum nit waaye tamit ñoo ngi seetlu ne comme private vehicles yi ñoom daal nekkuñ di def si yooyu noonu kon xam naa ne ñi nga xam ne ñoo amee wàll boobu noonu tamit maanaam foog naa dinañ gëstu loolu noonu tamit.
I think the traffic police are trying to observe that, but we need to study that aspect of the control has to strengthen. The effect on the taxi driver is the same effect on the private driver as well. So if you have to the taxi driver to take half passengers, the private driver should also do that. So I think the authority would look into that and study that aspect. I think the caller has a very important point.
Yeah, that's an important point. You want to say something, Dalia?
We just to keep in mind that this is the best way forward. It's the best practice. You have to reduce the customers. You cannot have 3 people in the back. It's just too much.
Just too much.
So, like Marlon said, we'll have to look at it and study it because, yeah, there are a lot of private cars, but that's transport. That's what people depend on. So let's see how many people are in the cars as well. We should look at that.
Okay.
Yeah.
It seems that we are out of time, and then we want to just wrap up this program. If there is no caller on the line. There's no call on the line. Okay, you want to say a few words before we wrap up the program, Lalia?
Okay. Thank you for having us. This has been really amazing. Just to keep in mind that FAO, WHO, NANA, Food Safety and Quality Authority are all doing what they can to help mitigate the situation. Just to let the population know that, feel free to eat food. Just make sure it's clean and hygienic. If you want more information, you can always go to our websites, full of Food Safety and Quality Authority on Facebook, Instagram. There's also an authority page of www.fsqa.gm.
Okay, that's the advice from Lalia from the
and FAO policies as well. There's a lot of advice out there.
Eat
telling
food that
people how
is
to
balanced diet, huh?
Yeah, balanced diet and hygienic.
Balanced diet. Okay, nutrition will tell you that.
Thank you very much. I'll end by advising people to diversify their diet. We talk about balanced diet, but it's difficult to obtain balanced diet.
Yes,
exactly.
What we advise people is to have a diversified diet that will meet their requirements and to ensure that they drink a lot of water.
Yes.
And ensure they also observe the hygienic aspect of not only the food, but also the environment and their clothing.
Okay.
People have to be so that, and we also observe the social distancing measures, physical distancing, hand washing, and ensure that
wearing
of mask, we are applying the hand sanitizer. These are measures that would help not only you as an individual,
60% alcohol.
Yes.
not you as an individual, but also the general public that are exposed to the virus.
Okay, that's it for this edition of your COVID-19 sensitization forum here on GRTS, together with its sister television stations in the country, QTV, Star TV, Paradise TV, MTA TV, and iAfrica TV. We are very much thankful to our sponsors, the Food and Agriculture Organization, FAO, and the European Union Ministry of Health, and other partner agencies. Thank you very much once again for joining us, and we want to thank our camera crew, the technical crew, and our able director, Babka Senghor, and our producer, Momodou Njai. Thank you from me, Mama J. Good night.
Coronavirus or COVID-19 is a disease that has no cure for now, but can be prevented. The disease is transmitted through droplets from someone with the virus. We can protect ourselves from getting or spreading the disease by washing our hands with soap regularly. Cover your mouth with a handkerchief or elbow when coughing. Avoid touching your eyes, nose,
Greetings from the sunny Gambia. This morning I arrived at Tendaba camp